Hello. Sorry, my earphones stopped working. Yes, thanks, Pudginells. We have come inside the bus. We're currently parked right slap bang in the middle of Lemon Key. We've come inside because the heavens have opened. But I managed to corner a familiar face. It's Kelly, everybody.
Hello, everybody.
So for those who maybe don't know, Kelly works for Stayathome, our care company. Kels, tell us a little bit about the care we provide and what you do.
So I am operational manager, so I just make sure that all the care coordinators and rota coordinators and things and all our supervisors and key workers are all doing what they need to be doing to make the clogs keep turning, basically. And as long as they're turning, we have happy carers, happy clients and everything. That's mainly the role that I do, and we support people mainly in the community, so anything from the age of 4, and I think our oldest is around the age of 100, so we care for anyone in between.
So for people who may be interested in joining the health and social care sector, working for an organisation like Stayathome is a really good place to start because there's a lot of variety, but it could also lead to a lot of pathways as well.
Yeah, so we've currently got obviously the care in the community we can do. If people want to work with younger people, we can cater for that. If people want to work with the older generation, we can cater for that. We're also doing some work in the hospital at the moment, providing support workers up there. And that's quite hard to get into from what I gather from some of the people I've spoken to. So they can get experience with that as well. Lots of stuff happening with Stay at Home.
And you do a lot of the recruitment for Stay at Home as well. There's quite demand in Cornwall for care staff across the county in various roles, and that's kind of why we're doing what we're doing today. Kind of what opportunities are available at the moment within Stay at Home or other areas that you can think of?
So I know that we're definitely recruiting in our paediatric and young people support role in Truro and in Hale. We've got some positions within the hospital work because that's a relatively new thing for us. So we've got them advertised as well. And caring for some of our oldies on the Rosen Peninsula as well, we're looking for staff for. So pretty much most of the stuff we do are available for recruitment opportunities.
And opportunities on the table at the moment, they are lots of ways into it, but people don't necessarily have to be skilled, but we also maybe look for people who might have been in the workforce before who might be looking to come back as well.
Yeah, definitely. And even if you have never worked in it, but you have helped do it on a personal level for a granny or an auntie or, even if you've just had children and raised your children, if you've got them... You've got those life skills really that are really transferable to any work in care, so it's really relevant.
And there's also projects for people who may be out of work at the moment, who are looking for a bit of support, maybe want to learn a bit more about the care sector or volunteer as well. Projects like Positive People, Who Dares Cares can all help.
Yeah, definitely. The Positive People has been great. It's been going for quite a long time now, it feels. And if we ever find anybody in care that isn't quite ready yet, could do with a bit more training or support, then we always link them with the Positive People team. And then at the end of it, 9 times out of 10, they could have a job with us at Stay at Home, but they just need that extra support in the middle, and it works really well to do it that way.
And today is very much about bringing the sector together as well, because the staffing crisis across Cornwall, across the country at the moment, it works better if, as providers and the sector, we work together, doesn't it?
Yeah, we're all working towards the same goals. We're all trying to care for the people of Cornwall. And so if we can be united, if I get people's with CVs from people that are already currently working in care, I kind of think like, oh, how if we take them on or interview them, how is that going to affect their organisation then? Because we know the challenges that it presents. So I do maybe target a little bit of those unemployed people or people that work in other sectors to try and bring them back, because it's an amazing sector to work for, and a lot of times when you're working in the community it doesn't really feel like work. You're doing such fun stuff. So definitely a great sector to work for, and I wouldn't work in any other.
And how did your journey start?
I used to my granddad used to be the main carer for my grandma, and so they were my go-to parents. That kind of made me think, oh, actually, I can do what my granddad does, and I could probably do that for other people as well. And that's where it kind of started, and it's developed from care worker through to now. I came in to the office in the rota team, and now I do operation manager. So yeah. Right through.
Kels, thank you so much for sharing. Now, just remind people at home how they can get in touch if they want to ask any questions about some of the opportunities we have as Stay at Home, if they maybe want to find out more about us or the Positive People Project.
So I think they can call into the main phone number, which is 01872 277 600. Stay at Home are on option 1 of that, I believe, or they can email me direct, which is kelly@stayathomecornwall.co.uk.
And if you're in and around Lemon Key, come and say hello. Big green bus, dressed as superheroes. You can't miss us. Cal, thank you so much.
No worries. Thanks, Nath.
Pajal, sending it back to you. We are going to catch up with some more people a little bit later, so stay tuned.